good afternoon. On behalf of my fellow trustees of V Citizens Action Network, our collaborating partner, the Rotary Club of Bombay for the Social Sanchar, our college partner, Jai Hind College, our venue also today, and our knowledge and health partner, HealthSpring, I welcome you all both here in the hall, in the audience, and our online audience. Today's joint initiative of bringing a community organization, the Rotary Club of Bombay, the V Citizens Action Network, which is a registered trust, and a college, which is an educational institution, jointly together to create an atmosphere of awareness and understanding about cancer is the brainchild of Mr. Suresh Goklani, former executive chairman of Eureka Forbes, which is also our founding partner for the web portal through which we do the Social Sanchar. He is the chairman of the Cancer Aid Committee of the Rotary Club of Bombay and the president of the board of the Jai Hind College, and a dear friend of VCAN. We all extend our warm and sincere thanks to Mr. Goklani for his proactive role in bringing us all together for a cause which is worthy of everyone's concern. This is not a cause that normally as a Citizen Connect organization we have taken up, but to tell the truth, it's a cause which can touch any one of us at any time if it hasn't already touched us. The month of November is also the National Cancer Awareness Month, and the National Cancer Awareness Day falls in November too. So this unique collaboration is a long-term one, starting with this Social Sanchar. At the end of the panel discussion, we have a galaxy of doctors, and I would request all of you to understand that the doctors are not here to clinically talk to you about cancer. They are here to have a conversation with you, both in-house and also online. So let's not look at them with very serious eyes. Let's have a chat with them. And at the end of the panel discussion, there will be a set of recommendations which will come through, and then we will take the joint activities forward. We also thank our technology partners who are based in Kolkata, Technolegion, and our video tech partner whose technology we use specially for this Social Sanchar, which is pretty unique in itself. Special thanks go out to our friends in the media, and most of all, to all the young adults who have come forward to be part of this movement. Let me just share the Social Sanchar format with all of you. Some of you who have already participated earlier perhaps would know it. The TogetherVCAN's Social Sanchar is open to all, anywhere in the world. We have the motto of interacting with your government from wherever you are. Quite unfortunately, this afternoon, our speaker, the panelist from the government, Dr. Sanjay Mukherjee, has been unable to join us because that was the last minute. Those of you who are in Mumbai and in Maharashtra will know that our Vidhan Sabha is in session, and he has been called to the assembly, and there's really nothing much any one of us can do. However, he has assured us that post our panel discussion, whatever that will be the recommendations and wherever we need our interconnect, that will happen. Now, in the Social Sanchar format, the opening remarks, we will have the theme being addressed by my fellow trustee, Mr. Ranganathan. Thereafter, each of the panelists will make their own opening remarks which will be of approximately 10 minutes each. Thereafter, we will have a panel discussion, perhaps amongst the panelists, or we'll open it up for public interaction. We have received numerous queries on our SMS. Just to step back, we had invited all of you to join here in-house as well as online, and our phone line, dedicated phone line for SMSs have been open. So we have received numerous questions. No doubt we will not be able to take up all of them, but we will certainly take up a few. The rest of the question will be answered by each of the panelists as appropriately, and it will be uploaded on our portal, as is the custom. We also have received some Twitter questions, and there will be live tweets, I presume. So we will take questions on Twitter. If we get a Skype call, that too we will take as and when it comes. So this is basically the social Sanchar format, and we are live. We will end at 5 o'clock with closing remarks by the panelists and a certain amount of light moments, and thereafter invite you all to join for some light refreshments. Now, the panel discussion itself is divided into two parts. The first one is more technical in the sense the panelists will speak on issues related to cancer, its impact, etc., etc. The second part is where our young adults come in. I have told the principal of the college, Dr. Wadia, that it's not the students that we are talking about, but our young adults. And what is special about today's social Sanchar is that whilst we have the young adults of Jai Hind College, many of them, here with us in the audience, I am delighted that young adults from St. Xavier's College, HR College, Sydenham College, MMK Bandra, KC College, NMIMS College, and I suppose a few more have joined in online. Now, this initiative is completely by the young adults of our Jai Hind College. So they have, as a nodal college, interacted with various colleges, and I dare say will, because this social Sanchar is not the end of this particular movement that we are starting today. Having said that, may I now invite my fellow trustee, Mr. V. Ranganathan, of whom I will share a little introduction. We are very fortunate in V Citizen Action Network to have him as our trustee. He is the former Chief Secretary of the state. He has led the state. But before that, he was also the Municipal Commissioner with whom I started all my work. So we have a special bond. So even though we may not have our current government official here as a panelist, Mr. Ranganathan, I appeal to you also to take up a few of the points that you think appropriate and share the theme address with all of us.
I think it's indeed a privilege and pleasure to introduce this eminent panel. We are fortunate in having a panel of the topmost oncologists in the country with us. And I begin with Dr. Ramakant Deshpande. He is an MBBS from KMC Hubli, did his MS from the Tata Memorial Center, and he has had trained in Sloan Kettering, New York, and Royal Marsden Hospital in London. And after a long tenure in the Tata Memorial Center of 16 years, he is now associated with an organization, Asian Cancer Institute. And I am a very remarkable thing I find, apart from pioneering many new procedures in cancer, he has 56 publications in national and international journals, and a number of books to which he has contributed chapters. So it's remarkable how he has been able to get the time for doing all this. And he has been presented with many awards. I won't take time to recount all of them, but I would say that among others, he was awarded the National Honor Padma Shri in the year 2014. So we welcome you, sir, and we look forward to it. Now I have to my right Mr. Pinto, who is a cancer and blood specialist, trained and worked in USA for 15 years in eminent institutions, including Sloan Kettering. Currently is a consultant medical oncologist and hematologist at Jaslok Hospital, Breach Candle Hospital and St. Elizabeth Hospital in Mumbai. So we welcome you, sir, to the program and look forward to it. Now I proceed to introduce Mr. Vinay Deshmane. He's a surgical oncologist and specialist in breast diseases, an alumnus of the Grant Medical College. He worked at the Tata Memorial Center for 8 years, and he has subspecialized in breast cancer in Guy's Hospital, London, and he has been I would say this is one of the institutions, one of the pioneers in the world in the study of breast diseases, and he has also undertaken some research and got a PhD, MD from the University of London. He is attached to British Candy, Hinduja and Asian Institute of Oncology, and he has been the pioneer of breast endoscopy in India, and he has also been, a number of awards in this thing, medical director and trustee of the Indian Cancer Society, in charge of the Mumbai Cancer Registry and editor of the Indian Journal of Cancer. So I think it is really remarkable to have a person of his eminence with us. Now, I proceed to introduce Gautam Sen, MS and FRCS, is an eminent medical academician who has been a member of the Board of Governors of the Medical Council of India, chairman of the Indian chapter of the Royal College of Surgeons, Edinburgh, president of the Association of Trauma Care of India, and presently he is the director of surgical education in the Association of Surgeons, chairman of the College of Surgeons, president of Healthcare International, chairman HealthSpring Community Medical Service. And I think when we are discussing about creating community awareness and early detection, Dr. Gautam Sen will be of enormous help to us in this work. And basically what we are trying to do in today's program is, these are the 5 things. One is create awareness about common cancers and their indicators. Secondly, what are the preventive measures which can be taken to prevent cancer? Because today what is happening is that earlier days when infectious diseases are common, people died early before they could get cancer. Now as infectious diseases are coming under control, you find that the lifespan is increasing, people live up to 75, 80, 85, 90 and so on. And so cancer is becoming a more common illness. And that is the reason why all over the world, as longevity increases, the incidence of cancer is increasing, and it has become a major health concern. So first is to create awareness about cancer and what are the indicators. Secondly, what are the preventive measures which can be taken so that one doesn't get cancer. And thirdly, early detection, because today medical technology has advanced so much that if a cancer is detected early, it can be totally cured and the person can lead a normal life thereafter. And then further, the community issues such as how to counsel people who are having cancer, how to counsel their family members, and lastly, what is the support system that we require for them in terms of the medical facilities, in terms of health insurance, in terms of various government programs. And these are the issues which we discuss. We look forward to a very informative, enlightening discussions. And we are fortunate that we have been able to get the student volunteers so that whatever action points emerge from the discussions can be carried forward by our young health ambassadors. Thank you.
So we start our panel discussion. The panel is led by Padma Shri Dr. Ramakant Deshpande, followed by Dr. N. Pinto, thereafter Dr. Vinay Deshmane, and lastly Dr. Gautam Sen, who will take the community perspective and primary health care. So Dr. Deshpande, please, the floor is all yours. Is it on? Is the mic on?
Hello. Yeah. Thank you very much. At the outset, I must thank Mrs. Malkani, Ranganathan sir from the VCAN, the V-Citizens Action Network, Dr. Ashok Wadia and Mr. Goklani on behalf for coming from the college, and Rotary Club also. Thank you very much for giving me this opportunity to be in a Mumbai's leading college. I don't remember when I last went to college, and I would not like to quote the year because that will actually tell you my age. I mean, even men think like that, so that is what it is. We are here to discuss about cancer. Now, whenever we use the term cancer, it's probably got the highest scare index. There is a reason for it, because untreated, unlike any of the other diseases, cancer actually kills. There are no chronic untreated cancer patients who go on to live for 10 years, 20 years, etc. Apart from that, we also have some amount of perceived suffering. There's a lot of stress over the family. There's a lot of economic expenditure and so on and so forth. So that's why cancer is very problematic. Now, we have a band of ambassadors, the volunteers who are ready to take this particular thing on. So what are the things that we really need to know? What is exactly cancer? Now, if you split, we have almost about 3 trillion cells in our human body. We are born with so many cells, and when we go with a certain number of cells. They are not the same cells which are there all throughout our life. So each cell has to actually duplicate itself, and then the original cell goes away. And each cell also has a dual function. For example, the skin cell also has to protect the body. The liver cell has to produce the liver enzymes, and so on and so forth. So there is a fine balance between reproduction and the specialized function. And this balance is controlled by a formula which is there. It's a script which is written on the genes. If for any reason, if the script changes, then invariably the script changes in favor of multiplication. So the cells will continue multiplying, and they actually form a mass over a period of time, and they serve no useful function. They keep on swallowing the nutrition of other cells, and eventually they become dangerous to the human body. The rate at which it can actually happen depends upon the type of a tumor, but it will happen over a period of time. And this dangerous cells, the unbridled proliferation of cells, is called cancer. There are various types of cancer which can occur based on the anatomical location, the reason why it occurs. So you have the head and neck cancers, you have the chest cancers, you have the soft tissue cancers, etc. From country to country, the pattern of a cancer from a sex, like male and female, will have different types of cancers. In India, we have a population of about 130 crores as of now, and almost last year the VCAN, the total number of patients who suffer from cancer, the data has come out, and 12,50,000 new cancer patients were registered in 2017. Now, how do we really know this? We have cancer registries where all this information actually flows. People actually do a lot of study there, and this is what actually my colleague Dr. Vinay Deshmane will talk about. There's a lot of, without the data you can't really progress. You can't really know what exactly is happening. So 12,50,000. So it is said that in the developed countries, every 5th man today will develop some kind of a cancer during his lifetime. This is the kind of a magnitude you're looking at. And every 6th woman will have some kind of a cancer. 40% of these people will die of cancers in the developed countries, and 60% of them will die in case of developing or undeveloped kind of a countries. So generally, the lower scale of development is actually associated with worse prognosis for a few reasons. One is common sense would dictate that you can't really reach the facility. Your awareness of the cancer itself will be slightly low, so the diagnosis is in a later stage, and then the affordability question also comes. So you know, it's a double whammy. One is you are still developing country, and then you are getting worse kind of a prognosis. So this is the problem in case of VCAN. Now, as I said, there are various types of cancer. The three commonest cancers that you see in men is one is the head and neck cancers, the lung cancer, and the esophageal cancer. So these are the common cancers which are normally seen in men in India. In women, what we see is the breast cancer, the mouth of the womb, which is called as cervix, and the ovary. These are the three commonest cancers that we see in case of women. So each cancer is basically what it actually does is it causes either some kind of a disturbance in the external appearance in the form of either a mole or a bleed or something like that, or it disturbs the function of an internal system. Now we have a system of swallowing. You eat food. Now if there's a tumor inside, it will cause a difficulty in swallowing, or there may be a difficulty in digestion, dyspepsia. There could be bleeding per rectum while passing stools, etc. In case of urinary system, there could be passage of blood, difficulty in passing urine, so on and so forth. So there are several systems in the body. So any disturbance in the functioning of a system, any mole which appears on the body or an existing mole becomes ulcerated or starts bleeding, a white patch which comes on the mouth, these are the things which are what we call as danger signals of cancer. So there are several, 7, 8, 9 danger signals of cancer which people need to be aware of these particular things. Now why does cancer actually take place? There are the usual suspects. Chronic irritation of any kind. Now what is a chronic irritation? You can have tobacco consumption in any kind of things. You could smoke, you could actually use it as snuff, you could eat tobacco. Several ways of tobacco ingestion are known. I think people are really very innovative when it comes to it. And if you add alcohol to it, it becomes absolutely worse. External radiation of any kind, atmospheric pollution. The World Health Organization says that if you're living in a city like Delhi or in Mumbai, it's equal to probably smoking 10 cigarettes. And this is the reason why we actually find that the cancer incidence is going up in women. You know, women, otherwise there is no real reason why cancer should be increasing in case of women. Atmospheric pollution, stress of the hormonal changes which occur with every menstrual cycle, so on and so forth. These are the things which contribute this thing. We have 12.5 lakh new cancer patients in this country. 55% of them are women. 45% of them are men. As I mentioned, the mortality rate is almost about 60%. Now, if you take a breast cancer patient in America, and if you take in India, almost 30% to 40% eventually will pass away because of that same breast cancer after their presentation, sometime during their lifetime, in case of Western countries. That percentage is practically double in case of India. 50 to 60% will pass away. So this is basically awareness is not there. So these are the areas where a lot can be done in our country. One is go into areas where we can actually prevent. You know, the best way to tackle cancer would be to prevent it. There are several ways of doing it. One is don't get into a cancer-provoking kind of a behavior. So, you know, less of stress. Obesity is one of the causes. Diabetes is another cause. So keep your weight as normal. Incorporate some amount of exercise. Have a regular checkup, physical checkup. If at all something is happening in body, get it checked. 99% of the times it's not cancer. But that 1% chance, if at all you get it diagnosed, and for example, in a stage 1 cancer of any kind, we have cure rates of almost about 90 to 95%. Whereas in stage 3, that percentage of cure comes down to practically less than half, about 25 to 30%. So early diagnosis is very important. And if you avoid the cancer, if you do preventive kind of checkups, these are the things which actually help. So the facilities are available all around. I mean, where do you do your checkup? You can do it at the closest physician or even in a center. For example, Dr. Sen is actually is a chairperson of the HealthSpring. Many of you must have seen HealthSpring clinics all around. So these are the places. You go to any hospital, big hospital, have a comprehensive checkup done. This is not necessary at a very young age, not at the age of 17, 18 or 20 or anything like that. But the moment we cross the area into adulthood, 35 or 40, the examination, physical examination becomes absolutely essential. Let me just give you a small example. If you have a small scooter or a car, you will see that it gets serviced twice a year. You'll spend some amount of money, and that money is definitely more than what you'll spend for your own physical checkup in a hospital. And we don't really do it. The most precious gift that God has given us, and it's a one-time gift, and if it goes, you can't do anything about it, and that's our human body. So this is what we need to do. And as ambassadors, if you want to know your role, one is get knowledge of this particular entity, what we call as cancer. Don't try to Google too much about it. Get into some kind of an orientation kind of a program, which can be done at either a hospital or a clinic, or there are those orientation programs which are available, facilities which are available, and try to, each one must teach one. You know, you can train the people, you can teach the adults in your own area. A lot of people who are working very hard, they have no time to get into this kind of a knowledge. So this is what you can actually do. Number two is you can actually donate your time. You know, we don't have a system of time banking as of today. Hopefully it will come sometime. But you can actually be of assistance to people who have suffered from this particular ailment, and you can be of great help to them. As we go along, we'll discuss it later. Thank you.
Thank you, Dr. Deshpande. Actually, Dr. Deshpande really brought it back, you know, to our level. So, you know, one of the things that we say that when I asked all of you a few days ago, what was your first reaction when I said cancer? So all of you sort of said shocked. So now I think we'll be less shocked after today, hopefully. Dr. Wadia, principal of Jai Hind College, was supposed to speak a little earlier as per your program, but we have a surprise. So he too is not aware of it. So therefore, the surprise will come shortly. May I now invite Dr. Pinto to share. Now, you know, many of you will not perhaps give it a thought that just oncologist is not good enough to know. There is the surgical part and there's the medical part. And one of the most common components which you as young adults are very good at doing is donating blood. So Dr. Pinto deals with the medical part and with blood. So Dr. Pinto, floor is all yours.
Thank you. Thank you, VCAN Network, Mrs. Malkani. And as a part of being a vice chair of the Rotary, Mr. Goklani here from the Rotary Cancer Aid Committee, the chair, has done a lot to get this action movement forward. So thank you, Jai Hind, for, you know, having me back here. You know, this is my second talk at Jai Hind. It's like coming to college almost, like Dr. Deshpande was saying again. The last interaction was excellent. The students had so many questions, very tough ones, but we managed to get through that. Now I have others to answer the questions, so it's much easier. So first, next slide. So my first thing to talk about is that India actually has a very low incidence of cancer if you compare it to the rest of the world. My first slide shows about what is cancer, and I think we've spoken a little bit about it. Cells undergo mutation, changes, produces far faster than the surrounding tissues, so you get a lump or a bump, okay? And that's what you see on the slide there. So you know it's growing much faster. Now, if you see India in the light blue, our incidence is very, very low in comparison to the rest of the world, where the incidence is really, really high. But that's completely changing. Many patterns, and that's what we're here to discuss, a lot of patterns, and that's really, really changing. Next slide. So on the left-hand side of the slide is a picture from 1990. Now, as you go, this is an article just published in the Lancet this year on India's cancer patterns. And as you go up, you see darker is more incident. That means cancer, there's more cancer being picked up. And as you go lighter, that's less cancer. So that's 1990, and you see all light shades, right? And this is 2016 in India, across all states. So there's a big difference between the left and the right. So we've got to try to figure out what we've got to do about that difference. Now, breast cancer is the most common cancer now currently in Indian cities. It used to be cervical cancer. In fact, in the US, cervical cancer was also very incident. And the only way the incident dropped is because of screening through something called as a simple pap smear. Okay, and we're going to talk a little bit more about screening. Next slide. Also, the only one point I want to put in this slide is that 80% of all patients in India come when the cancer is really at the end of it, so they come last minute. And there's always an excuse for that. Either there's someone's wedding, someone's 10th standard exam, my cousin's getting married, and everyone keeps postponing and postponing and postponing. So the one thing I think to take out from this whole talk is, if you have a problem, you need to go get it checked up right away. Next slide. A lot of people say, what causes cancer? And no one wants to utter this word in India, cancer. Because why? If I say I've got cancer, my daughter's not going to get married. You know why? Because they say cancer's in the family. But if you look at genetics, it's about 4 to 5% of entire cause for cancer. So it's not something to be really afraid of, or not something to have a stigma to. We have a lot of other causes for cancer, and tobacco exposure is one of the main causes for cancer. Other stuff like HPV or viral infections can also cause cancer. And there are a lot of cancers that research are actively involved in trying to figure out why these cancers are caused. So a lot of percentage we don't have answers to, we're still looking. But again, genetics is just a very, very small percentage. So don't take it on that your entire family will, get that if this cancer exists. Next slide. Now, the left side, which I've circled in the red, is India. And these are stages for cancer. Now, stage 1 is a very low-grade cancer. Stage 4 is a very high-grade cancer. And those are the top 4 centers that collect data for India. And most breast cancer is in the 2nd and the 3rd stage, right? And that's, on the right-hand side, is the SEER data for the US. Almost all their breast cancer comes up in the stage 1. Next slide. And that makes a big difference. Because when you see in the first stage, when it's localized, 5 years survival, that's what we look at cancer outcomes, 5 years survival is close to 100%. Well, when we go to an advanced stage, that drops almost to 25%, to 26%. So it's very important to catch cancer early. Next slide. And the only way to do that is to try to screen. That's number 1. Screen to prevent, to get cancer early, so that we can do something about it in an early stage, so that improves your survival, right? That's the main goal of screening, okay? Asymptomatic disease. Next slide. Now, in breast cancer, the only method that we currently have is mammography to look for screening. And this decreases almost 20% improvement, in your odds of dying from breast cancer. A lot of people are very scared of going for a mammogram, and they say, oh my God, kitna radiation, so much of radiation. It's very minimal radiation, but a lot of benefit to go through. Next slide. Now, there are different types of mammographies. A plain old film mammography. Nowadays, you have digital stuff. And there's also 3D mammographies coming, to identify breast cancer in a better format. Next slide. Also, when do we get a mammography? This is data from across all the guidelines across multiple developed worlds. And everybody at least thinks after the age of 50 is a good age. But in the US, we used to start at 40 and on a yearly basis, even though the data shows that every 2 to 3 years is good enough. So I would recommend, next slide, at about 45, every 2 years is a good interval for mammographies. Next slide. Risk factors. There are a lot of risk factors for breast cancer. A lot of say, how do we prevent breast cancer? Genetics, something called as BRCA1 and BRCA2 forms a small percentage of patients who have that. And we're always worried when you have a young patient having breast cancer or something called as triple negative breast cancer. That pops up for BRCA mutations. Drinking less alcohol, to all the youngsters in the room, also is a preventative tool. Having children, is also another preventative tool. Next slide. Pap smears. I said pap smears decrease the incidence of cervical cancer from number 1 all the way to 7 or 10. Currently, it's cervical cancer is still up there, in Indian women. So when should you get a pap smear? Above 21 years of age, every 3 years, or if you use HPV DNA, it's every 5 years, and all the way up to 65. Next slide. Vaccination, HPV vaccination, big topic. Everybody asks this question, and I think this is shown to prevent chronic cervicitis. And we know that HPV kind of is one of the main risk factors for cervical cancer. It's indicated for children 11 to 12 years, boys and girls. I do recommend that, and we'll talk about that a little bit more later on. Next slide. colon cancer, really increasing. It was very, very low in India. Now we're seeing colorectal cancers coming in 30-year-old patients and younger. Now, colon cancer takes almost 10 years to form from a small polyp to actual cancer. So this is one cancer which we can actually screen for through something called as a colonoscopy. Next slide. So in the US, when you go to your GP, when you're 50 years of age, he just clicks on it. You automatically say, hello, happy birthday, here's your colonoscopy, right? No one here gets a colonoscopy after 50. And I think we should get it. After 50, every 10 years is routine screening for colon cancer for colonoscopy. Another thing we see here is a lot of iron deficiency anemia. They say, okay, take some iron, your hemoglobin gets better. So I'm a hematologist, so I see iron deficiency. But no one's looking, why are we iron deficient? Are we losing blood in the stool? What's the cause of the iron deficiency? And one of the big factors, especially in older people, is colon cancer. Next slide. If you're a heavy smoker, above 55 years of age, and have had an extensive back year history of smoking, we now also have something called as low-dose CT scans. Next slide. That you can do yearly, to decrease mortality for lung cancer. Chest X-rays are not as good. This was data compared to chest X-rays. Next slide. Prostate cancer screening. It's a very tough thing. It's a shared decision-making model between guys and their doctors. And around age 50, a PSA would be a good idea to get, depending on your risk factors, and then repeating it every 2 to 3 years. It's a routine blood test. Next slide. Warning signs, already Dr. Deshmane has spoken about it. Any blood anywhere, if it's in your sputum, in your stool, urine, you need to go see a doctor. It's just not normal. If you're losing weight, and everybody is trying, so am I, not really effective in that. But if you're losing weight and you don't know why, no appetite, something's wrong there. You need to go see your doctor. So these are some of the warning signs to pick up, pain, and you're resting and that pain is not going. I mean, everybody gets a little ache here and there as they're getting younger and younger, right? Not for you young guys, but, But if that pain is not going away, you need to go get it checked out. Okay, next slide. Simple lifestyle, healthy weight, eat a good diet, less meat, limit alcohol. Everybody used to say 1 drink a day is really good for the heart, huh? There's a recent study just came out in the UK saying that even 1 drink a day actually is increasing your risk for cancer. So maybe just in the weekend. Huh? And avoid excess sun. Okay, we have very less melanoma or skin cancer, but that's going to start slowly increasing. Next slide. Now, everybody, whenever you get the word cancer, no one wants to even think about treatment. From a medical standpoint, they go to the surgeons. When we talk about chemotherapy, oh my God, it's like everybody's having a heart attack. All right, but chemotherapy nowadays is really well tolerated with a lot of the pre-medications. We know that chemotherapy can affect some normal cells too, and now we have targeted chemotherapy that has mutations only in cancer cells that can just go and bind to those cancer cells and destroy them. Okay, so that's called targeted chemotherapy. A lot of new changes in the treatment. Next slide. These, the small picture you see on the right is actually like, I call it a smart bomb chemotherapy. It's an antibody that just goes and binds to the cancer cell, but now we're attaching chemotherapy to that antibody. So you're taking targeted chemotherapy straight to the cancer cells and destroying them. Less side effects, but more expensive, and I think part of that, what we're going to discuss, is insurance, and I think it's a big factor in nowadays, for treatment of cancer. Next slide. This is just a slide to show you what's the difference, and some of these treatments are oral. On the right side, you see that big right black mass. That's a huge lung cancer, and that's 5 months later, there's no lung cancer. It's absolutely gone. And this is with just an oral tablet once a day. So chemotherapy is very effective, even if given oral. Nowadays, the molecular targets are very, very effective. A lot of people ask me, what is immunotherapy? Recently, this last month, 2 guys, one from MD Anderson and one from Japan, got the Nobel Prize for Science for immunotherapy. And what they're doing is, cancer cells normally block our immune system, so they can't really find cancer cells. Now we have drugs to go and unblock our own immune system to go and eat up cancer cells. So it's a very different mechanism for treatment of cancer. Rather than destroying cancer cells, you're stimulating your own immune system to go and attack cancer cells. And these immunotherapies, called the PD-L1 inhibitors, are available here in India. Next slide. older patients. You know, when anyone comes at 60, everybody says, oh my God, too old. Why are you going to see a doctor with cancer? As long as the patient's fit and has a good performance status, is functioning. Some, you know, people at 85, I have patients. One guy who's a CEO of a company, he walks 35 minutes a day more than I do probably, right? So we should offer chemotherapy to these patients. We're looking at the other comorbidities. Next slide. We can nowadays look for circulating tumor cells even in blood. Currently, we're not using it to diagnose cancers, but we're looking at it for prognosis standpoint. Next slide. Now, whenever we give chemotherapy, cancer cells change. So now we're looking at what changes happen in the cancer cell as chemotherapy is going through something called a circulating tumor DNA. So this is also something new. Next slide. Everybody, you know, so what we're changing is we're not looking at a one-size-fits-all, and we're trying to find out what your individual patient's cancer has, what's the whole genome sequence of that cancer, and what are the targeted mutations in that cancer to offer them treatment, chemotherapy, or targeted agents. Next slide. Now, in the Time magazine, CAR T-cells was out there as the best innovation of the year, and I said, I must put one slide in. This is the way cancer treatment is going to go. Leukemia, everybody knows, is a blood cancer. It's a very bad blood cancer. Once you fail initial treatment, survival is less than 6 months. So they took around 40 patients, 35 patients of leukemia, and they exposed them to, they took their own blood, took out their immune cells and exposed them to an antigen in the cancer and reinfused them. And all of them were cancer-free 3 years later. Unheard of. And now we have this thing just duplicating in your own blood. So this is something new, not yet available here, but it's approved for a couple of cancers in the US. Shortly it should be here. Lot of trials on all cancers, including solid tumors and liquid tumors currently. So CAR T-cells, you're going to hear a lot about this. Next slide. Yeah, so this is a cigarette, right? You have toilet cleaner, you know, rocket fuel. Why would you put toilet cleaner to your lips, right? So if anybody's smoking in the room, I think the #1 thing would be to stop smoking. And I can just see on the right-hand side, it affects everything. You name the cancer, tobacco causes it. You name the heart disease, tobacco causes it. So today is a good day to stop smoking if you have. We'll talk a little bit more about that. Next slide. So in summary, quit smoking. Cut down on your alcohol. I'm sorry, I'm a real downer here for most people. Healthy diet and exercise. Preventative health checkups help. And see the doctor if you're really symptomatic. And targeted therapies are now out there. So don't be shy. If you have cancer, go to a medical oncologist. See if there's a chance that your patient can get treated. Thank you for your time.
Thank you very much, Dr. Pinto. I think all of you may have been wondering about the number of slides and that you couldn't read it properly. Fret not. This whole presentation will be uploaded along with the report on our portal. So keep in touch and at your leisure, give it a thought and have a look. I did go through the slides last night. I found it very interesting. And I'm sure that when you guys look through, you will find it equally fascinating. Give it a thought. It'll be there for all of you. May I now request Dr. Deshmane to speak not only of prevention and your specialty of breast cancer, but do share about the Indian Cancer Registry and any other things that you feel should be in the overall management of cancer, which is related to. I should also share at this point that Dr. Pinto is the Vice Chair of the Cancer Aid Committee of the Rotary Club of Bombay. And now Dr. Deshmane is also representing a very important and one of the oldest NGOs in the field of cancer, that is the Indian Cancer Society. So what you see is that it's not the doctors have come just like that. They have come here because they represent, apart from being doctors, also associated with social movement. Dr. Deshpande is the Executive Chairman of Asian Cancer Institute. So, as I said, not just pure and simple doctors sitting here as your panelists. Dr. Deshmane, please.
Thank you, Mr. Malkani, Mr. Ranganathan, Dr. Wadia, colleagues and friends. First of all, it's a pleasure to be back in Jai Hind, and I'm a student from Jai Hind, so it's nearly 50 years since I was here. I'm going to speak a little bit about the Indian Cancer Society. That was a brief given to me. A little bit about the Registry program, which is unfortunately a not greatly appreciated program in the country, and a little bit about breast cancer. Can I have the first slide, please? Anyway, the Indian Cancer Society was formed way back in 1951. And you can imagine this was a era just after independence when there mustn't have been too much of money going around. And I think it was a vision of Dr. Jasawala, who was also one of the directors of Tata Memorial, and Mr. Naval Tata, who actually must have supported him throughout this whole aspect. And this slide really shows what this society has done through the years. So it's, of course, helped and supported cancer patients, which all societies now do. But can I have the next slide, please? But what is really most fascinating is the effect on scientific thought process it's had in this country. If you really see anything and everything which actually allowed cancer treatment to develop in this society and country was done by the Indian Cancer Society. So they did the first chemotherapy unit, the first rehabilitation unit, they have the registry program, they did the first immunotherapy, they started the Indian Journal of Cancer, they started the first cytology unit, you know, just name it. So they did things in diagnosis, they did things in treatment, they did things like the first Cancer Congress and the journal which spread education among not only lay people but also among doctors. So this had an exponential effect and throughout the community and spread the word about cancer treatment. Can I have the next slide, please? So one of the things to understand is what is so great about a registry program. And I think when you understand cancer in a community or in a population, there are three things one requires to know. How many patients are there in the community who actually develop this cancer, which is what we call incidence? How many people actually die with this, which is your mortality or the survival? And what is its effect on society in terms of quality of life and economics? So this is the sort of information one gets from the registry. Next slide, please. So that's what the Mumbai Cancer Registry, interestingly, is the first population-based registry which was started way back in 1963. And you can just imagine at a time, even today when I speak to doctors as well as lay people, they don't understand what a registry program does. So if they don't understand what a registry program does today, you can imagine how did they ever manage to get funds to start such a program way back in 1963. So what does a registry really do? This slide really tells you. It collects data, it collates it, it analyzes it of every single cancer patient in Mumbai over a 603 square kilometers. We also have a satellite registry in Pune, in Aurangabad and Nagpur, smaller areas. So we collate every single cancer patient that's diagnosed. That means we have to go to the labs, we have to go to the hospitals, we have to go to the different departments and try and just whichever patient's been diagnosed with cancer is noted. Then we try and find out trends. Based on all these things, we have published over 100 papers, and every year we get at least 1 or 2 questions which come from the government as to how many patients are in a particular type of cancer and should a particular area be addressed. So it helps a lot in cancer prevention, in knowing which area to actually give money to and what sort of development requires to take place. The next slide, please. Sorry, what was that? Yeah, so this is the trend. So let me come to the trends of cancer. No, it's okay. So this slide actually what Ian said, surprisingly we really talk a lot about cancer and we are seeing a lot of cancer. But the rates are not increasing in a way that we should panic. And as one of my colleagues, Dr. Badwe, who's the chief of Tata Memorial, really says, there is something good about our society which still hasn't allowed cancer to progress to such a great extent as in the West. If you see, this is data over 50 years, and we are the only people in the country who have this data, which shows that the lifetime risk of your cancer actually has not increased enormously as we think. So then what is the reason that we're seeing so many cancer patients? Our population has exploded. So the rates per lakh population have not increased dramatically, but our population has exploded, and even the small rates are making a massive jump in sheer numbers. So what we really require is we are not able to treat these numbers. We require a lot more money to go into treatments, and we require the money which goes into treatments to take it further. If you treat patients who come at an advanced disease, as you heard, there is not much you can achieve despite the amount of money you throw at it. So we have to catch it very early to make whatever money or the limited resources we have go further. Next slide, please. This is a slide which just shows how a registry can actually tell you what's happening in the community. Today we see in the men, as Dr. Deshpande pointed out, it's the oral cancers, it's the lung, and of course prostate has increased now. While in the females, it's breast, cervix, and ovary. What is interesting is that lung is coming up even in the ladies. Now, these are sort of changes which the registry program tells you, and this is really what's happening in our community. Our community is always under change. And when it's changing, you must try and see what are the reasons for this change. Next slide, please. So just with this background, let's look at breast cancer. Next slide. If you look at this slide, the figure on the lower side actually shows what the Mumbai Cancer Registry is showing. Over 50 years, breast cancer has increased. If you look at the slope of the slide, it's something to make you panic. Oh my God, look at it, it's increasing drastically. But it's not increasing so much. Over 50 years, it's only doubled. So it's about 2% per year. From 17.5 per lakh population, we now have 35 per lakh population getting breast cancer. So to me, as a breast cancer specialist who only sees breast cancer, I frankly don't think breast cancer is so common. But there are lots of people who are developing breast cancer, again because of a sheer population. But if you look at those figures on the top, those colored lines, they show what is happening across the world. Our rate is 35. If you go to the advanced developed nations, it's 100. It's more. So we have nearly 1/3 the incidence of breast cancer. Next slide. But what is more important for us are mortality rates. So, sorry, can you go back one slide, please? This is mortality rates. Now, the first problem we face is we do not even have mortality figures across every city of India. So mortality, which comes through from our public health departments, mortality is often not even reported. So we require mortality rates to come down. Unfortunately, in our country, mortality rates are not coming down, they're going up. Unlike all the other figures, if you see, they've reached a height and come down. Now that means treatments are much more effective in the West as compared to us. That doesn't mean that if you go to a particular hospital, your survival rate is going to be like that. That's not true. This is across the board for everyone who's being treated in India, that we are not having mortality rates which are coming down. And that is a real downer. Our mortality rates should either become static or they should start falling, which means that our treatments are becoming effective in the community. Next slide. And the reason they're not really becoming effective is because we come late. And cancer gives us a real chance to be detected. This is basically what the breast is. It's a collection of fat, and there is a gland which is supposed to produce milk. If you cut the tube which carries the milk to the nipple, it's got a lining of cells. Over a period of time, this lining of cells starts multiplying. Somewhere along the line, it becomes abnormal. Somewhere along the line, the DNA becomes bad enough for us to call it cancer. Then the cancer starts increasing within the duct. Then it starts coming out. By the time it's in the breast and you feel a 1 centimeter tumor, it is estimated by something called cell doubling times, 1 to 2, 2 to 4, 4 to 8, 8 to 16, 16 to 32. That's cell doubling times. It's been in the body for 7 to 10 years, which effectively means that when a person actually comes with a palpable lump, this tumor has been in the body for a long time, which also indicates that when someone comes with a lump, they shouldn't really panic because they feel everything's got to be done in a couple of days, which is untrue. You have enough time to plan, think how your treatment's got to be sorted before you get treated. Next slide. So this is really what happens to the cancer cell, which you've already heard. The cell starts doubling, it starts forming a mass. Somewhere along the line, the DNA gets enough information for it to start learning how the cells multiply, spread to different parts, and that's how you get what is called metastatic disease or cancer, which has spread in the body. And the later you treat the cancer, the less chances of doing well. And of course, as I said, the cost it becomes an ineffective parameter. Next slide. From breast cancer point of view, these are the things you must know. The commonest presentation is a lump. You can get skin changes, you can get changes in the nipple and areola, you can get some fluid coming out of the nipple, or you can just get funny sensations in the breast. All these point to something that's happening to the breast. And as Dr. Pinto has pointed out, when you go to your doctor, usually the 2 tests that are done is a mammogram and an ultrasound. And the diagnosis is always done by a needle biopsy, because you may see something on the mammogram, but the diagnosis can only be done by pathologists. Next slide. I just want to end by two things. You've heard a lot anyway about the treatments and things. At the turn of the century, this was considered the new thinking in breast cancer. Next slide. And all this is in practice today. We have smart drugs. We have what we call genetic forecasting, so we can look at your DNA and then of the tumor and say how badly this tumor is likely to do. We can predict which drugs will be effective in a particular tumor. We use breast endoscopy, which is this thing. We use different types of radiation therapies. We have short courses, long courses, on-table radiation, all different sorts of things. And one thing which is really missing from there, which really is the single most effective treatment for solid tumors, really is high-quality surgery. High-quality surgery for detected tumors which are detected early is a single most curative modality of treatment. All the other treatments, including drugs, which get such a lot of attention, and radiation, do not have the same effect. So you need to detect tumors early, and what surgery really does is debulks. That means it debulks the disease out of your body before the cells become so badly abnormal that we are not able to control them. Thank you.
Thank you, Dr. Deshmane. Having heard all of this, again, all PPTs will be uploaded, so you can refer to the PPTs. As a matter of fact, this entire broadcast will also be available live post 5 o'clock this evening. Now it's my very happy privilege to introduce a knowledge and health partner, HealthSpring, with whom we go back a long time and associated on multiple levels. But today, in particular, Professor Sen, so he's an academic. So normally we always say doctor. So I have to still get used to calling Dr. Sen by Professor Sen. So do excuse me, Professor Sen. What to do? So I always write Professor Dr. Gautam Sen. Makes it much easier. Okay, Dr. Sen, whilst you share about HealthSpring a little bit, but what we would really like you to say is, why do you think and what role the community plays, and more than that, how primary care is probably the first place where we could catch, or for awareness, or we could catch cancer, if that is what is true.
Thank you, Indrani, and my all great professional friends in medicine as well as outside, with whom I have been interacting on many social causes, social kind of movement, where medical profession and social people, the community at large, must work together for better health outcomes, whatever the area may be. And as you have seen and heard, such a lucid kind of knowledge on what cancer is and what one can do at various stages. But all of them have been saying about prevention. And I think one must have a clear idea about what prevention is. Prevention is there in many areas, of course. There is a Oxford Dictionary for prevention. But in clinical prevention, that's what we are talking about, is mainly which promotes health and maintains health and reduces the risk factor which can disturb health and which can disturb your maintenance of good health. So as Indrani, you say that primary care, it should be, I would go a step further, which my colleagues all described so well, is it starts with you. It starts with a particular individual. That is where primary care is. You should be in charge of your health. You should be investing in health. You should be also, you should have the knowledge of what are the danger signs, what are the things I should look for, And why, when I go to my physician who is nearby, who is my family physician, and there are many such great family physicians in the country, and not only in this city, but in the country, and especially in the rural region. They are great, but as you know, those great family physicians are dwindling. But I would suggest you go to a good physician, and then go with particular knowledge, not just Google and go with all kinds of things, but of course, it helps to go with that knowledge and say whether you have that screening test or I'm worried about it, what are you going to do about it? And that's where the primary care really comes in. And in any kind of health, reduction of risk factors, because there are risk factors. And this reduction can be done as a primary level. That means you can have vaccination, as you all know. There are vaccination for your child. There are vaccination as you grow old. You had your vaccination in the school. And you think that that's over. But you should start asking yourself, is there any kind of vaccination for myself as you grow, as I grow into adulthood, as you are growing? Is there any kind of vaccination for your aged parents or your uncle or aunt? So that some acute illness can be prevented, some viral illnesses can be prevented, and some cancer kind of thing, whether you can reduce the, what you call the risk factors, even for them. So having knowledge of that is something first which you should, and that's why we are all gathering over here. Prevention of cancer, and cancer is curable if it is caught in the early stages. You have wonderful institutions, not only in this city, but all over the places, but right place you should go, right care at right place at right time. Not the tertiary care kind of thing should be held at the primary care level for as long as possible, and wondering if the patient goes out of my hand to the tertiary care, what am I going to do? And afterwards, so everyone at every level must understand what is their capability, what they are good at, and how help they can get for their patient. Ultimately, it's a patient. Ultimately, for the people. That's your right to go to the right place at right time and at the right level. And there are various levels in the tertiary care as well. But someone needs to guide you. And that's where I'm thinking of starting with the integrated care, at least in cancer, with such a great institution, the Asian Cancer, where all my colleagues, many of them are juniors, some of them are contemporary, with whom I have worked myself as an onco-surgeon, and later on as a member of various organizations in the government. I've done that and realized our health is in our own hand. We cannot wait for someone else or the government to take up that, because 2/3 of our health cost of the GDP is borne by out of pocket. Only 1/3 goes from the government investment in health. And the present government has come out with a wonderful health policy in last year, in what is called as Health Policy 2017. It came after 1983. That was the last health policy of the government. Can you imagine? So at least this government has given that kind of importance. Ayushman Bharat. They're talking that both primary, I think there should be a lot of attention in primary care, a lot of attention in strengthening primary care, so that speciality later on, whether be in the, I can see here my colleague Ashok Kriplani, so that the kidney disease doesn't go to his hand at some stage, but it has to go with chosen good people who require his attention and not swamped with people or not sent at the last stage of the renal disease. So that's my, I think, involvement with you. I would like our young people to come forward. As Dr. Deshpande had said, there is a lot of volunteerism which is required. In fact, purely from, I would say from your own selfish point of view, if you do this to get into a good university abroad, which is all your dreams are, most of your young adults' dreams are who come to Jai Hind College, one of the things which they see for selection in these foreign universities, good universities, is what sort of social activity you have done. This will really help you, because this is volunteerism must come in our society to help give some time to the elderly people, find out some time, not all the time. These are the time available. I've seen in emergency medical services, bankers give their time to become driver of the ambulance abroad. So the young people are there, and for the cancer is preventable, cancer is curable. It is not such a dreadful disease as you say, that, and as our colleagues in the very specialty tertiary care hospitals, and they are here. And as Dr. Pinto has mentioned about the best of the things are available. But why go at the last stage? Why not go at the early stage? And it starts with yourself. First, you start saying that I swear by my parents that I will not smoke in my life. Can you do that?
I'm hearing a very feeble yes, but then I think we have something up our sleeve just now.
That's
after
right.
Dr. Sen finishes.
That's right. So I think I finish at that. The primary care starts with you first, with the community first. Go to your nearest doctor, but the doctor should be aware about what are the screening tests available, not just array of lab tests and forget about it, but analyze them to pick them up and start reducing the risk factors on his own if he can. If he cannot, then he should guide you to the right secondary care consultant. Thank you.
Thank you, Dr. Sen. Once an academician, always an academician. Never forget that, and we are in a college. That brings me
I'm a practical academician.
Yes, that I do know.
I do what I say.
Absolutely. That brings me to our very special partner, Dr. Ashok Wadia, principal of this college. The Jai Hind College is VCAN's collaborating college partner, but today it is a unique collaboration that has come about. Dr. Wadia, your thoughts as to why you think our young adults should be part of this, and why the college has made sure that we didn't have our social Sanchar where we normally have, but to have it in your domain.
Thank you. First thing is, it gives me immense pleasure first to welcome you. I know it's my last turn. I should have welcomed you first as a host, but nevertheless, it gives me really immense pleasure, not only to have the eminent doctors who are sitting here, Padma, Shri, Dr. Deshpande, Dr. Sen, Dr. Pinto, and our own Dr. Deshmane, and Ramakant, and also Madam both. And also Dr. Goklani, my friend, we share the same first name, and also Ashok Malkani first name. So there are so many people which I know. Now you will wonder, like say, why the question which is put, Jai Hind College. Jai Hind itself means salute to the nation. So this is a huge legacy which is there for us to carry forward. Now if you ask me, and our president is also on the board of Rich Candy Hospital, you ask and go to any hospital, you will find there has to be a doctor from Jai Hind College. So Jai Hind College has given to the society. the doctors, engineers. We are the most sought after college, I know that. Academically we are strong. Then question comes is it enough? It is not enough. Where Jai Hind is concerned, we believe that we want to produce good human beings. We want to inculcate the values and virtues among our students. And particularly if you see our vision and mission, is that we want to produce leaders, but who have to be good citizens. I think you understand what I'm trying to say. So this is very important. With this, what we started is college social responsibility. So under which we have done many such ventures to give back to the society. Now who will give back to the society? If these kind of things are inculcated at a young age among our students to understand that society has given something, even this particular entry in this college, then it's very important that they should give back. And with this particular cause. Now when I mentioned there are eminent doctors and it is written doctor in front of me, I'm not MBBS doctor, but I'm microbiologist. And I can proudly say that my students have worked on in the Cancer Research Institute, Tata, particularly to develop the antibodies which can be linked so that target can be found. Similarly, my student at present is working in the VCAN for the stem therapy. So you see that we are considering to give back to the society. And I'm glad that when I put it to my student, now I should say that they are adult, because after hearing this, they are mature to that young adult level, as Malkani madam wanted to say. And I asked them that, are you really want to do this? Or this is just a one-day event? And I believe that in this college, that any activity we take, it has to be sustainable. And therefore, my question was to my student, and what answer I got back is that, sir, if we want to get into this, it will be lifelong. So they are lifelong health ambassador. Can I have the health ambassador standing?
Yes, please.
All of them, please.
So, here comes, Dr. Wadia, if I may add, here comes the launch of the partnership between HealthSpring, Asian Cancer Institute, and the health ambassadors from Jai Hind College.
Yes.
So, and if you notice, they're all three partners sitting there, and the facilitating organization being VCAN. So generally, we all have to be a busybody to get everyone together. Yes. A special thanks to President of the Jai Hind College Board, Mr. Suresh Goklani. So therefore, all of us are in it together because, and we are launching it at the end of November, which, as I said, is a National Awareness Cancer Month. Why are we doing it at the end? Because you young adults are now going to take it forward. It's not stopping with the month, but you have to take it forward in the days to come and the years to come, because collectively, we all believe that we need to know cancer in order to say no to cancer. Yes? Why a week, yes? Sorry, Dr. Wadia, I thought the launch was...
I think that is very important that it is launched, because they have to know or understand the cancer, as it was rightly put by the doctors. And once they know the cancer, they will be able to say no to cancer, and that no also should come from the others. And that is by stopping this particular kind of addictions and things. So they will be the ambassador which will be spreading this message. And I'm proud of them, and I'm sure that they will take this forward and will ensure that many more will join in this band ambassadors of health ambassador. Thank you very much.
Thank you very much, Dr. Wadia. Health ambassadors, please note, your training will begin at HealthSpring centers, which is across Mumbai, Greater Mumbai City, in Thane and in Navi Mumbai. And so therefore, we make it easy and also make sure that you don't scoot, that you will go to centers which are very much possible and near to your homes so that you can make good use of it. We will be sharing with you the details of the training module. You will be given education kits, etc., etc. I'm really delighted with this partnership and this coming together on this platform. So now we go back, take a seat. I think as we have, I think somewhere along, The opening remarks and the panel discussion have sort of got very nicely mixed, and happily so. There are two things which I wanted to raise before we open it up very quickly to our public interaction, that perhaps during the interaction also, doctors, if I may, many of you know that very well known, Nafisa Ali has got a certain amount of cancer. Many of you may have read it. What interested me was this to go in for a CA-125 blood test. Now, I never knew about it, and mind you, I spend enough time with doctors around, but didn't know about it. Maybe you could also take this up during your question time. And the other is to do with the environment, that the genetically modified foods and the mercury in the soil. I think there are some of these things that have been raised. We have received many questions on SMS, and a few, I think, also on Twitter. So before we take questions from the in-house audience, our online audience are anxiously waiting. So if you may have an SMS questions. I don't know who it is.
So this is a
it's about question. About yoga.
Is it true, and how? Dr. Deshpande, who would like to answer?
It's on.
No, the answer is there is no proof that yoga can cure cancer if you don't get treated by regular curative means like surgery, chemotherapy, or radiation therapy. So don't just rely only on yoga. Yoga will definitely help. One is because it helps you focus your mind. It probably makes your mind and body stronger, so you can withstand the rigors of undergoing treatment and to recover faster and to integrate yourself in the society. So the utility value of yoga is unquestioned, but it has no curative potential by its own, and don't get misguided by anybody who says that his or her yoga can actually cure the cancer. So the answer is no.
Thank you, Dr. Deshpande. I'm very happy to announce that I've just been informed of our online audience from USA, Canada, United Kingdom, and Kenya. Welcome, international audience. Very happy that you have joined us. Let's take one audience question in-house, please. I can see quite a few hands. Yes, the lady at the back, I will come to you. Can we have the mic, please?
Excuse me?
Is there a lady? I thought I saw a hand. Otherwise, bring the mic forward.
Very good evening. My question is to Dr. Ian Pinto. As you had mentioned in your presentation, there's a vaccination for HPV. Could you please throw some more light on that, please?
So, I'm sorry for running through the slides very fast. It was a very short period of time. I had to get a lot of information in. So, HPV is a human papillomavirus. It's a virus that causes chronic infection. For women, it causes chronic cervicitis or inflammation of the cervix. And in men, it can also cause anal warts. This vaccination has been shown to prevent these infections. Now, we know that certain HPV or human papilloma viruses actually increase your chances of getting cervical cancer. So giving kids this vaccination can actually prevent HPV. And there are multiple types that are like, there's a quadrivalent, like I put it up in my slide, there's a 4-valent strain or a 2-valent strain. And these are given like 2 or 3 shots. And normally at about 11 years of age, before sexual activity, to prevent this.
Is there any particular age limit for this vaccination? Can it be given to elderly people also?
So normally not, normally we think that sexual activity would probably get you HPV somewhere along the way, so not that effective later on. So earlier, better.
Thank you, Doctor.
Just to add a little bit, HPV, the human papilloma virus, is supposed to be an etiological factor in case of cancer cervix in almost about 60% of cervical cancers. So if you prevent that infection from progressing, logically, the incidence of cancer should go down to that level, right? But HPV, the infection is supposed to get transmitted sexually. So before the lady becomes sexually active, that is the age to vaccinate and to train their immune system. So between the age of 11 to 16, this is in the Western this thing. But before anybody becomes sexually active, if you give that, that is the way it is to be done. 3 doses are normally given.
Dr. Deshpande, okay, I was wondering if... Huh? Yes, Dr. Sen, you wanted to say something? No, I was just wondering that what happens if the person is sexually active and had not taken, can the person still take? Does it have any effect?
See, there is never a wrong time to do a good thing. So you can probably still take it. But the utility value is totally established in these ages. So how much is going to be useful later on in the age, that data is still not really available to us. But one very nice thing about this, it's so easy to take this particular thing from trained people. For example, now, if somebody like, say, Dr. Sen offers this particular thing as kind of a promotional this kind of activity, then it can easily be given everywhere. And it's a very simple injection, can be given by a specialist or even a general practitioner, and 3 doses are to be given. So, it's very simple. Similar kind of methodology of immunizing people against hepatitis B actually brought down the incidence of hepatic cancers tremendously. So that is how useful these things are.
Yes, Dr. Sen?
I think what is important is knowledge of this thing. You are asking this question. It's a great thing. And I think what the whole idea is to reduce the risk factors as much as possible in prevention of cancer. We are talking about prevention, not the best treatment. So even after doing prevention, if you go to that kind of stage, then the outcomes of your treatment will be far better than nothing has been done at this initial stage of prevention. So you should be aware about it, and HealthSpring is very much involved in this, and we have now a kind of partner who would always help us with the knowledge and skills. But the only problem with this HPV vaccination was its cost. Now, if you give 10,000 rupees for your marriage of your daughter, and you spend lakhs and lakhs of rupees on almost crores many times for your wedding ceremony, or giving ornaments to this. This is the best thing what you can do for your daughter. Why not? Even if they say that it is reducing the chances, and in great quantity, in great percentage, that why not do that around, say, 11 and 12 years of age? And as Raman said, that good things, there is no ban on good things. So even if it's late, you can take care of your health. Please take care of your health, of promoting it and maintaining it. Invest in your health at whatever age you are.
Thank you, Dr. Sen. Can we take another SMS question, please? And may I have the mic over here, the lady here? Yeah, here, come down. Here. Just a minute. The lady here, in front. Not here. It's there. You have to give it there. Whilst... Yes, please.
I'd like to ask Dr. Pinto about this question. He mentioned that why after the age of 65 a lady should not have a pap smear done?
Great question. Thank you for your question. So one of the key things of screening and the benefit of screening is to prevent early disease, right? And if you don't pick it up by 60, 65, normally, that's the key incident area. So you're not gaining much, in screening after 65. Maybe there are other things that would, prevent your survival from X, Y, and Z, So your main incidence of, cervical cancer is probably a little bit earlier before that. And even the question could go to even mammography, in that way in 70. So that's also, the same reason why. You're trying to increase life expectancy by screening and picking it up earlier. Currently, all the studies that they did looked at that age group as the maximum targetable audience. And maybe now the question when people are living up to 90, today I was treating an 85-year-old for multiple myeloma. I've been treating him since he was 82. That's the CEO I was talking about. He walks every day. He's functioning. He was fighting with me to even stay in the hospital for 1 day. So now maybe the treatment paradigms might change, and even maybe screening data might come out for later age groups. That's a great question.
Madam, just one question. What you are asking is something at a cross purpose. What you ask now is, should a 69-year-old lady should she do a pap smear? Yes or no? Yes, she should. Right now, you must understand the difference between a screening and a diagnosis. Now, if a patient comes to say Dr. Pinto, Dr. Deshmane, or to me, and I examine her, that is not a screening thing. That's an investigative procedure to identify whether there is a malignancy. But when Dr. Sen actually runs in his 25-30 clinics a program for identifying if at all there is any malignancy in the cervix for say 20,000 women, that is what is called as a screening. The aim of a screening is to reduce the incidence of advanced cancers in a given population. So is it cost effective? Is it practical? After the age of 69, doing that is not really cost effective, nor is it practical. But if you as an individual go, no matter at what age, after the age of 30, your examination will mandatorily include a pap smear. Okay. So that is what it is important.
Thank you. Thank you.
Thank you very much, Dr. Deshpande, for clarifying this very crucial aspect. I believe there are some Twitter questions also which have come in. Yes, this is an SMS question.
At what age tests need to be initiated for detecting cancer? Does fasting 20 times a year help to prevent it? What are the tests to be done?
Yes, I think Dr. Deshmane. I think your mic is on, hopefully. Is the mic on for Dr. Deshmane? What seems to be the issue with the mic, please?
Well, let me take, does fasting 20 times a year help? Well, fasting will help improve your overall health. It will decrease obesity. And obesity is one of the main sort of factors which seems to indicate an increase in a lot of the cancers. A lot of the cancers which are today lifestyle related. For example, we talk about the breast cancer, the ovarian cancer, the endometrial cancers, all are considered today lifestyle related. We keep talking about genetics. First of all, we have certain factors which we can control, certain factors we can't control. You can't control your genetics because I think you'll find it very difficult to change your parents. So this is basically what has been passed on to you. So that cannot be changed. But how these genes change through your lifetime, and obesity is one of them, which is supposed to cause inflammation in your body, which causes changes, and this is something that one can control. Breast cancer, ovarian cancers, endometrial cancers have today all been sort of related to obesity, increase in body mass index. And one of the differences between the developing nations and the developed nations really is the BMI. And we feel that as we become more and more westernized, this is something which is going to affect. So 20 times fasting, I think, may not really have an effect. But overall, decreasing your obesity, increasing physical activity as a lifestyle change is very important. So that's point number one. There's something else that they asked.
Symptoms of breast cancer.
For symptoms of breast cancer, we went through that. The commonest is a lump. Sometimes you can just get a little puckering on the skin. You know, if you pucker the skin just over your wrist, the little lines that you can see, you can sometimes just see a little bit of puckering. You may be able to see some changes in nipple areola. You can sometimes get discharge from the nipple, and you can sometimes get some lumps which come under your armpit. So these are generally signs of, maybe a sign of breast cancer. I mean, as I said, breast cancer is not always, is not a very common entity. When people come to the outpatient with a complaint in the breast, I would say 80 to 85% of the time, they're not likely to have breast cancer. It's only 5 or 10%, 15% of the time that we actually find a cancer. But these are warning signals that one must look for.
Thank you, Dr. Deshmane. I think one of the takeaways from what all of you are saying is, particularly where breast cancer is concerned, is that I think all of us need to be aware of our bodies. We tend to cover ourselves up, but there's nothing stopping us individually as women to know our bodies. And that goes for men too, because I think one aspect which is probably not known is that it's quite common also, or is it not so, for males to have breast cancer?
Well, 1% of all breast cancers occur in males, yes. So
and
males
that's never associated with, one doesn't associate breast cancer with male, but it's very, very important for the male population to know about it as well.
That's right. The other thing one can really do to decrease incidence of breast cancer, as they say today, is, breasts which have been denied their function. That means if you have early children, you breastfeed. Today it's been shown that if you breastfeed beyond 1 year, and also cumulative, so if you have multiple children but you breastfeed for nearly 3 years overall, the incidence of breast cancer actually drops. And it also decreases the incidence, interestingly, of ovarian cancers. So for breastfeeding, and it's estimated today that Western society could actually decrease the number of breast cancers simply by breastfeeding and having the average number of children that are seen really in the developing world. And I think this is really fascinating.
Thank you. Are there any audience questions? I know that we have multiple SMS questions. Yes, please. You have the mic with you? Yes.
Excuse me.
Hello. Hi. Thank you to the panelists and the moderators for this informative session. I wanted to ask...
sorry to interrupt. Sincere request, whoever's got a mobile, kindly switch it off or put it on silent, because this is a live broadcast. And whilst we want to hear our panelists, we don't want to hear the mobile sound. Thank you.
I wanted to ask something specifically about tobacco and smoking. I think by now it must be decades-old knowledge that smoking causes cancer. So why has it not worked? Why have we not been able to control this habit of smoking in the population? And what efforts have worked and are working, or what efforts have not worked? If you could give a few examples.
See, there are almost about 13 malignancies to 14 malignancies which are directly associated with tobacco. The reason is tobacco actually has, when you smoke, there are almost about 4,000 chemicals, out of which 200 to 300 chemicals are directly causing cancer. There is a direct connection between that. Now, when we know all this, why don't we really stop the tobacco habit at all? Now, in developed countries, this is actually happening. The consumption of tobacco in developed countries is definitely falling for 2-3 reasons. One is the social education and awareness itself. And secondly, when the causal association has been established so strongly that the damages claim suits have come up with such vengeance that even the tobacco companies are very wary now of promoting. Thirdly, the governments across the world have taken very, very stringent actions. Now, if you want to buy a packet of cigarette today, you will see a lot of cautionary kind of warnings there on the packets, and same thing. There are a lot of restrictions for selling tobacco products close to schools, colleges. You can't really smoke in the public today, so on and so forth. It is happening. Now, there are several states today which have practically banned smoking in the public spaces altogether. Now, has it really stopped smoking in everybody? No, it has not, because we still have this idea of freedom of choice. So you can't really do that. That's what I understand. I don't smoke myself, so I don't understand that. But I think it will happen over a period of time. And till that time, I think we'll just have to wait.
I think
Just wanted to add one thing to that. So another specific measure that actually has been done and has been effective is raising taxes. So if you go for the price of a packet of cigarettes in the US, in New York, probably it's, I don't know, now maybe $12, I don't know, $10, $12. So when you take out that money to buy that packet, you'll think twice about it. And slowly, I think there's only two sureties in taxation. Cigarettes and alcohol are always going to increase in taxation. So the more you tax, cigarettes, it's an indirect measure to shut down the use of tobacco. And I think that's a measure that's worked there. I think that's a measure that we can use here to, shut down the use of tobacco.
I think our health ambassadors will have a great role to play amongst your peers as to why smoking is not cool at all. Ultimately, it leads to something very uncool, right? So that's something you might keep it.
Take up this on behalf of this, our social ambassadors. What is rules and regulations have never stopped the things what it is meant for. It's the spirit behind it. It's the community which should accept it with whole heart. It's the social changes. And in Western country, as you know, that if you start smoking, there are rules and all that, and the prices have also gone up. And that's not the thing. It's unfashionable. It's unfashionable for a young, educated couple to smoke. You are sort of excommunicated through the society with the fashionable crowd, with the educated crowd. And please remember, nicotine, tobacco, is addiction. It's extremely difficult to remove that addiction. There has to be sort of integrated kind of care with the primary person and as well as someone who specializes in removing that addiction. People who are smoking, they are got hooked. Sorry about that. It's addiction. It's as addiction as marijuana. Probably much more than that because marijuana is banned and we still have not banned tobacco. So we young people still feel it's fashionable to go to the hookah joints. Apart from the infrastructure damage, safety, those are thrown to the winds. But it's fashionable to go to the hookah joints. So as Indrani says, it is for you to bring these social changes. All this caste system and this and that with all rules and regulations, it doesn't happen. Over the years, it happens. And today the young crowd, I know that you are the future of India. You will change this system because you will bring in this awareness of what is the real life should be and not rules and regulations.
Thank you, Dr. Sen.
May I quickly add just one more point, madam?
Yes.
You know, the important thing about India is it's not only just smoking. It's smokeless tobacco, which is really our problem. It's pan, gutka, pan masala. And if you really analyze what is the content of a pan, which is so popular, it's really the vitamin A, which is in the leaf, which is really protective, and everything else which is there practically is carcinogenic. So it's this gutka, pan masala, I think that is really a problem which causes oral cancers far more than lung cancers.
Thank you, Dr. Deshmane. Dr. Wadia apparently has
I'm talking in the terms of, like, say, the young students and habits. When they talked about this social part of it, you see that just to get accepted by the peers, the peer pressure, many times the students start this. And they start in the school, unfortunately. And then it's not difficult to give up the habit. I had a student, the parents had admitted that the student had hooked up to this and was not able because I caught the student on the road. And brilliant girl, and I found it, unfortunately, was smoking. I brought her. But believe me, after talking to her as a microbiologist, and not only talking about cancer, I spoke more about the TB, and which is rampant if you read this. And that is where you'll find she changed. After 6 months, she came and told me that she had given up. At the same time, I had seen it on the TV that when the gutka ban was there, somebody is saying, I will eat the gutka because if what happens to me is my concern and not the government concern or the public concern. So it's very important that the message should go because today corporate world, all the ladies consider that if they join that and join smoking, they will climb the ladders. Something is wrong over there. I always say smoke and you will go in smoke. So therefore it's very important that you should not do this. And remember one thing, I want to share this as a microbiologist and the trials which have been done, you will find that you keep the tobacco and the rat will not come near that. So you can see that the animals, if they understand what is not good for them, I think intelligent people like us, if we are still following this, then I don't know where we are going. And this is where the young people have to take it up and to understand that what they should do. Sorry that, doctor's panel, but
No.
I thought this is important for me.
It's not sorry at all. And I think it's really great that...
And every orientation, along with the students, I appeal to the parents. Because many times the students say that my parents are smoking, so therefore it is in the house. But I think that is not the case. I said you have to prevent your parents from doing that particular thing. That is something which we should take it up. Thank you.
Can we have the mic here, please? There's a lady who wishes to ask a question. And we'd like to take up some SMS question before we'll... Yes, ma'am.
Yeah, just one question. This is not only about the active smoking, but something about passive smoking also we'd like to know from doctor. Because I do understand, I also am aware that passive smoking in the family is actually more harmful to the family members around. Is this true, and is this,
yes, Dr. Deshmane, would you like to?
Well, yes, passive smoking is as bad. Smoke in all forms is really not good for us. So it's really something which shouldn't.
Dr. Pinto, you want to add anything to it?
So, I'm going to take one point from, what Dr. Sen said about, group. I think if someone is smoking in your house, even if it's a guest, and if it's exposing you to it, I don't think you should be a part of it. And I'm never. So if someone is smoking, I always tell them, you're welcome, but outside, Because not only are your kids out there, your family's out there, you're exposing yourself to that tobacco. So I think it's a time we took a stand, and not about hurting people's feelings or whatever it is. We should take that stand because we're exposing ourselves to it. And tobacco lingers in the house for a long period of time. That doesn't go for a long period of time. So I strongly would suggest anyone smoking, should be, and that's why bars and everything in Bombay were actually banned because of that, because of health workers or people who worked in these facilities who were exposed to tobacco all the time. So I think passive smoking is as bad. Thanks.
Can we have some SMS question, please? You want to read it?
This is a question. I never heard the term cardiac cancer. Is it the only organ which does not cause cancer?
Very interesting question.
Any live tissue. There are only two tissues which are not live in a human body. Three, I think. One is the tooth per se, the hair, and the nails. Except for this, you can get a cancer in everything, including the heart. So if you have not heard of it, probably because by the time they get a cancer there, the patient is dead almost immediately. So, and it's an extremely rare type of a cancer. So that's why, but it's not true that there is no cardiac cancer.
Yes.
So what is the frequency of prostate cancer with reference to those suffering from enlarged prostate?
See, enlargement of prostate can be a benign enlargement, which is a non-malignant, and then there is a cancer prostate. These are not necessarily superimposing. Everybody who gets benign enlargement doesn't always get a cancer of the prostate. So it's very, very rare kind of a situation. So you don't really need to worry about that. Now, how many of these, both the diseases take place almost in the same age group, and that's why sometimes they get confused. But one doesn't convert itself into another. So you don't really need to worry about it.
Could we have the Twitter question? I understood I was shown a whole lot of Twitter questions have come in. Whilst we take another audience question, would you please see about the Twitter?
What is the difference in leukemia and lymphoma?
So leukemia is when malignant cells are in the blood, so it's leukemia. And lymphoma is normally when cancer cells involve the lymph nodes. So it's a more solid, more solid form of a liquid cancer. So leukemia in the blood, lymphoma in the lymph nodes. Now, what are lymph nodes? Everybody has had tonsillitis or pharyngitis. You see the neck stuff that swells up here. Those are the tonsils. Those are also a part of our lymph nodes. And we have small lymph nodes like this all over our body. And normally lymph nodes protect us from infections by eating bad stuff. But when cancer gets into the lymph nodes, they actually use the lymph nodes to spread from one point to another. So, and lymphomas normally come in a lymph node.
Yes, ma'am.
Hi. So this was a very informative session, and thank you for that. My question is regarding the HPV vaccination that we've already spoken about. We've all spoken about how costly it is and not so affordable. And incidentally, there is no government program providing HPV vaccination. So my question is, are there any alternative solutions? Is there any upcoming research or any innovative solutions which can prove as an alternative to HPV vaccination?
No, there is no alternative to HPV vaccination as of today. The only alternative which can come up is if some Indian company comes up and manufactures the polyvalent vaccine at a much lower cost. It's bound to happen because this is, understand that this is it's expensive today because it's a proprietary imported product. So once the patent goes off, then it will be available probably at 1/10 cost. So that's what will happen.
But there is something very interesting in our society. You know, we have had a very high incidence of cervical cancer, and we have now seen a drop. We have seen a drastic drop in cervical cancers, where from being number 1, it's now gone to number 2. We expect it to go to number 3 and 4. And it's a very simple reason. Availability of water, availability of toilets, cleanliness and hygiene. These seem to have really made a difference for cervical cancer. And the incidence of cervical cancer actually has come down very much to what now is in the developed world without vaccination. So this is a very, very important aspect. And there is always some discussion with the costs. How long will this HPV vaccination actually be effective for? How long would you have to keep on giving booster doses? A lot of things are not known. The second thing is when you do a screening program, the endpoint of a screening program is decrease in mortality. That means death, which has never been shown with the HPV vaccination. So there is some amount of controversy about the whole HPV vaccination program. Yes, it's been shown to be effective to a certain extent, but if you really go into the depths of it, there are certain concerns, especially in the developing world, with the costs that are involved.
Thank you. Thank you, Dr. Deshmane. Thank you, Dr. Deshmane. I think what's happened to is the audio all right? Sometimes technology does throw a curveball. So somewhere along, I think mic went off. Thank you so much, Dr. Deshmane. I think answering many of these questions, what comes through is that cervical cancer and smoking, the two things, the oral cancer, I should say, which leads to lung cancer, right? These two becomes a focal point for our health ambassadors subsequently. So as we work out the training module, we will work more towards that and see to it that that is properly integrated. All the questions that we have not been able to take today due to the session closing time nearing, we will be on passing all the questions to all the panelists, and each one I request to give their answers, which we shall then have it consolidated and uploaded with the report. So this should be done in the next few days. We will on pass the questions to you by tomorrow, by email, and you will kindly reply. Yes, all the doctors. I have now another announcement to make. The Rotary Club of Bombay will be coordinating through their office, and I will just share the name and the number. Jaslok Hospital has offered from the 1st of December to the 10th of December certain tests which will be carried out by them. Please use this opportunity to spread the word to your network that they can use this opportunity to call a dedicated number. I'm sharing the number and we will have it uploaded on our portal as well. They will be doing head and neck examination, routine blood test, general checkup by physician, both men and women, and some surgical examination for men, gynecological examination for women, and also surgical examination for women. I'm not going into the total details. We will have it uploaded. The person to contact is Ms. Rushali Palwankar, and the number, it's a Mumbai number, is 2202-4089. As I said, I'll have this uploaded, and you can also send an email to her, which is vrushalirotary@gmail.com. I have just made the statement, but it will be uploaded, so you will not make any error there. Now, those who wish to avail of this cancer screening will be contacting Ms. Palwankar. Is that right? Rotary Club of Bombay? Yes. Yes. This screening, for the limited time that I have just mentioned, 1st to the 10th, will be free of cost to the person who's going for the screening. So please make use of it, and this is in Jaslok Hospital. SL Raheja Hospital, which is a Fortis associate, has also offered certain facilities which the details I will have uploaded on the portal as well. So, and this is also part of the Rotary Club of Bombay's initiative, and they will coordinate this. I have given you the name. As I said, I'll put this up on the portal so that you may please visit. And you can also go to the Rotary website, and I'm certain that you will find the same information there as well. I think many of you are wondering that where you will go from here. Some of you may be feeling a bit bemused as well. Please don't. Cancer is not something to run away from, not to get spooked, not to get scared. If it has to come, it will come. But let's make it very, very difficult for cancer to enter our lives. That is something in our hands. And I think that is something which we should endeavor for, all of us. I thank you all for being with us, not only here and online, international online, and everywhere else. We are not going anywhere. This will remain an ongoing subject which we will carry through. Our health ambassadors will be trained and take it forward. We will be having a sequel to this program. But before we end the session, I have a happy task of requesting for the panelists, and we would like to share a memento on behalf of VCitizen Action Network, the Rotary Club of Bombay, and the Jai Hind College to our panelists. May I have the memento for Dr. Ramakant Deshpande, please. And I request Mr. Ranganathan to please give the memento on our behalf to Dr. Deshpande, please.
Very enlightening presentation.
Look, that's it.
Thank you.
Dr. Ian Pinto, may I request Captain Saurabh Kapadia to please come and present the memento on behalf of all three of us. To Dr. Vinay Deshmane, Captain Ashok Malkani, please, Trustee VCAN, on all our behalf. May I have the memento of Mr. Goklani, please? Cancer Rate Committee. Sorry. Mr. Suresh Goklani, on behalf of your hat of President of Jai Hind College President, may I request you to present a memento on our behalf to Dr. Gautam Sen. Yes, yes. You have to look this side. May I have the memento for Cancer Aid Society? It gives me great pleasure, on behalf of V-Citizen Action Network, to hand over a small memento to Mr. Goklani. May I request the Director of Cancer Aid Committee of Rotary Club of Bombay to present a special memento to our other collaborator, Dr. Ashok Wadia. Indeed, this is really a happy photo. Thank you all for being with us. We bring our session before we bring our session to a close, may I have a group photograph, please? The two trustees of VCAN, Dr. Kripalani, Mr. Goklani, would you just, shall we come forward? Yes. Or we come here? Because we'd like to have we'll come in the front.